Hello, welcome to Ellevate Louisiana's joint meeting of our taxation and our workforce policy committees. I'm Julie Stokes, founder and CEO of Ellevate. Today, we're joined by Jan Moller and Peter Robins-Brown to discuss inclusive economic development strategies and the policies affecting working families in our state. Jan Moller is the executive director of Invest in Louisiana, where he leads research, advocacy, and outreach efforts across the state. He has over 20 years of experience working and reporting on public policy in Louisiana with expertise on the state's budget, tax structure, as well as healthcare policy and the public safety net. Peter Robins-Brown, the executive director of Louisiana Progress, has spent close to a decade in Louisiana politics. He has worked as a community organizer, campaign manager, and lobbyist, passing state and local laws and building coalitions. Jan and Peter, thank you so much for joining us today. And with that, let me turn it over to you, Jan, to get us started.
All right. Hi, everybody, and thank you, Julie, for the invitation. Every time I see Julie, I'm reminded of her sitting in our old office probably 12 years ago, when she was a new legislator, fairly new,
Yeah.
but really took an interest in taxation, and the two of us geeked out, and we didn't completely agree on the solutions, but I think we agreed on the goals, and I've always been appreciative of these conversations. If
Thank you.
you don't
Thank you.
know us, Invest in Louisiana for most of our time was known as the Louisiana Budget Project. And true to that name, and really true to this name, our role is to look at the state economy through the eyes of low and moderate income families. There's a lot of great people in Louisiana who look out for businesses, and I think businesses are very well represented at the state capitol. But when we look at our state, we really look at what kind of policies can we uh, put in place to help the sort of the Alice population and below. If you're familiar with the Alice population, about half of the state, the households in this state really struggle day to day, week to week, month to month to pay their bills. And what kind of policies can we do that? And we do that through the lens of the state budget. We are interested in, the most fundamental things that the state does is we decide, how much money we're going to raise in taxes, who are we going to raise that money from, and how are we going to distribute those dollars. And those decisions play a huge role in the welfare of Louisiana families. All right, so just want to kind of level set on where we rank, and I don't think this should be a surprise to the very educated women in this room, but we have the highest poverty rate in the country. We have the second highest child poverty rate. The poverty rate among Black children in Louisiana is almost 50%. I think it is an absolute atrocity that 1 out of 2 African American children are living below the federal poverty line in Louisiana in 2026. Uh, the second lowest for household median income, and this is the one that always gets me, we're the fourth highest income inequality. So we have a lot of wealth in this state. I always say we're a rich state with way too many poor people. And so that's our kind of biggest concern when we talk about policies. We're also extremely dependent in Louisiana, in part because of our huge, very high rates of poverty and our frequent natural disasters. We are uniquely dependent on federal money. Every state gets federal money. We get more federal money as a percentage of our budget than anybody else. And the federal dollars that we do get, by and large, support people with low incomes. They help us buy health care for people. They support our K through 12 schools, and they help people put food on the table through SNAP. And I'm going to talk a lot about how these programs are threatened, and our ability to fund these programs are threatened by some of the recent changes that were made by the federal government, Congress this year. So I want to kind of level set a little bit also about where we are with the state budget. The budget is, I think, coming out on next Friday, a week from tomorrow. I don't know what's in the budget. The governor hasn't shared those details with me, but I did see he was at a had a press conference this morning, and so we got a little bit of insight into where he is. I was also there when the revenue estimating conference met in December, and there was kind of a lot of back patting. And the idea was, well, look, we got a little more revenue, everything is good. This means that the tax reform changes worked, everything is rosy. The fact of the matter is, things are a little better than they were before December, but the revenue forecast, the latest revenue forecast, is still below where we were in 2024. FY24 was the high water mark for state general fund revenue. That's the revenue we control. Um, and it's not keeping pace with inflation. So we're down a little bit. We were down a little bit in 25 from 24. We're going to be down a little bit again in 26. We start going back up a little bit in 27, but on an inflation adjusted basis, our state revenues are kind of flat and very slightly decreasing. The second thing is the tax changes that were put in place last well, I guess a little bit over a year ago now. Um, we're still kind of figuring out exactly how that is going to play out on state revenues. As you know, if you recall, the state legislature, they cut corporate income taxes, they eliminated the corporate franchise tax, they cut personal income taxes, and they paid for that in a couple of ways, mostly by going up on the state sales tax. So we are now the highest sales tax community in the entire country. And they eliminated some business tax breaks to kind of flatten out. There's a lot of business tax breaks that we were doing that made our tax system kind of, we picked a lot of winners and losers, as my conservative friends would say. Julie.
With the state revenues being below the high water mark in 2024, is pretty much because of what we did in tax reform, or is it something else?
I don't think we can say as far as I can tell right now, it was mostly revenue neutral. I think the slight downturn in revenue is mostly due to the economic effects of COVID petering out. We had a lot of federal money come in, and that money generates, it goes to people, and it generates income, and people use that money to buy things, and that generates tax revenue. So I think we'll know more as all of these things play out. But I think as far as we can tell, it was mostly revenue neutral. What I did hear the governor say today, and I hate to I'm not saying this to sound partisan at all, but he was having a press conference this morning to unveil his fiscal reform recommendations and a new inspector general, and he said, "Well, we did all this after passing the largest tax cut in state history." Um, that is not really true when you look at like what actually happened. It wasn't a tax cut, it was a tax shift. So while revenues are mostly flat, we changed uh, who is paying those taxes. We are asking corporations, and when we talk about the corporate franchise tax, those are majorly large global corporations that operate in Louisiana. So when you cut the corporate franchise tax, you are cutting taxes on shareholders of large corporations who don't live in Louisiana. So we cut taxes on corporations. We cut taxes, income taxes, mostly everybody got an income tax cut, but the vast majority of the benefits fell on people with higher incomes. And then we raised the sales tax on everybody, and everybody pays the sales tax. And so we made our tax system, which was already regressive. In other words, people with high incomes pay taxes, state and local taxes, at a lower rate than people at the with low incomes. We made a regressive tax system a little bit more regressive. and we ended up with about the same amount of revenue. And then at the same time, we also have, and this is something we have no control over, all of these federal dollars that were coming in, starting with the beginning of the pandemic, and then ARPA, and then Infrastructure and Jobs Act, and all of the post-pandemic money from Washington is starting to peter out of the state economy. So that's kind of where we are heading into this. Um, and then the other huge thing that happened, the one big bill, a lot has happened in Washington in the past 12 months, but the one thing that Congress actually did that's going to have a huge effect on Louisiana is H.R. 1, the One Big Beautiful Bill Act, what we're calling the Budget and Tax Mega Bill. And uh, without going into it too much, the bottom line there is a provided very large tax cuts. It added to the federal budget deficit about $3 trillion over a decade. But in practical terms, we had very large tax cuts skewed heavily towards people at the very top. And we paid for some, but not all of those cuts, tax cuts, by cutting spending on these social programs, particularly Medicaid and SNAP. And the way the bill was structured is the tax cuts take effect right away, but the budget cuts that are going to affect states like Louisiana are being staggered in. So we're not going to feel the full effects of those, some of those not until 2028. So a lot of the big effects on Louisiana's budget aren't going to show up in the budget you see next week, but the budget you see next year and 2 years from now. And why is this important? Well, from our perspective, Medicaid and SNAP are two enormous programs that affect a huge number of people in the Alice population, and they're mostly funded with federal dollars. In the case of SNAP, 100% right now of the benefits are paid for by the federal government. The state pays 50% of the administrative costs, and SNAP, of course, is food stamps. And then Medicaid is the cost share varies by the population, but generally it's about 1/3 state dollars, 2/3 federal dollars that help us buy health care for people who can't afford it on their own. And so what this law does, and I'm not going to, we could spend an entire webinar on this, but we know that it is going to end up taking away Medicaid coverage from a lot of people. We're going to take away SNAP benefits from a lot of people through work reporting requirements and other restrictions. But probably the biggest effect on the state budget is going to be the way it shifts dollars, costs of these programs from the federal government onto states. And that is true of SNAP. And actually, I've been on calls this morning because one of the big issues coming down from SNAP in a couple of Congress right now, this weekend, is expected to pass some appropriation bills. One of the things that the federal law does is it requires states for the first time ever to pay a share of the SNAP benefits. The law does two things. Again, it makes us pay 75% of the administrative costs starting next year, October of this year, actually. So the next fiscal year. Julie, you look like you had a question.
Yeah, so I thought the state paid all of the administrative costs.
It's 50% state,
Ah.
50% federal, and that's going to go to 75% state, 25% federal, beginning in the 2027 fiscal year, which starts on October 1st of this year. The federal fiscal year is October 1 to September 30th. But then starting a year in October 1 of 2027, there's supposed to be a cost share of the benefits, which right now are 100% federally funded. And that state cost share is going to depend on the error rate that they have in SNAP administration. And so if you have a high error rate, you're going to pay more. And if you have a low error rate, you're going to pay less. Right now, Louisiana's error rate is fairly low, but there's kind of a catch-22 here because in order to reduce your error rate, you need to spend more money administering your SNAP program, but you also have this disincentive to spend more on administration because your costs are going up in that area. So right now, one of the things that's happening in Congress, in order to get the votes to pass the bill, the Congress did something called the Klondike carve-out, where Alaska got a 2-year reprieve on this requirement because to get their error rates down. So one of the things that is being asked of Congress right now is that every state should get the same deal as Alaska and get a little bit extra time because if this doesn't happen, then 2 years from now, we're going to pay anywhere from 95 to almost $300 million a year to draw down the same amount of benefits that we are getting now at no cost. That's in addition to the administrative costs. So just on SNAP alone, and we haven't started talking about Medicaid and provider taxes, there are these big new costs coming down to the state. I know that 100 million doesn't sound like a lot. That's almost it's not that far much less than what we pay for the entire community and technical college system in Louisiana to bring it back to workforce. And of course, the state has to balance its budget every year. So when we have these new cost requirements coming in, you got to take that from somewhere else. And so this affects not just people who might need food assistance, but it affects our ability to pay for discretionary things like early childhood education, workforce training, TOPS, whatever the things that we have in the budget that are discretionary that help us build a strong workforce and build the kind of economy that we want to see for everybody.
So you feel like, or the estimates that you've seen is that the changes to SNAP very well likely may cost about 100 million to Louisiana.
As of right now, just the cost share on the benefit portion is $95 million. That's kind of the best case scenario. Plus another $20 million in the that's our increased cost of administering the program.
Wow.
And if I were a state official who wanted to get that error rate down, I would be asking for more money to help help administer this program to make sure that we don't get charged $300 million a year to administer the SNAP program that right now is 100% federally funded. Other big thing is on the Medicaid side. There's and I don't have a slide. I can send that. I can revise this presentation if anybody's interested. But there are kind of two major threats on the Medicaid side. One is the work reporting requirements, which we know are going to cause a lot of people to lose their coverage, not because they refuse to work, but because they aren't going to be able to comply with the paperwork requirements. Maybe they moved, maybe they ignored the letter, maybe they just filled out the form the wrong way. We know this because that's been the experience in other states, that most of the people who lose their coverage due to work reporting requirements are actually still eligible, but they just didn't do the paperwork the right way. And so when people lose their coverage, it doesn't mean anybody gets sick any less. It just means that when they get sick and they go get care in our healthcare system, those doctors, those hospitals, those clinics don't get paid for those services. That has an effect on people's ability to work. That has an effect on the financial health of healthcare providers, which in turn affects all of us who have health insurance. So it's in everybody's best interest to make sure that everybody who goes to a hospital or a clinic or who needs medicine is able to afford that and that the provider gets paid. And that's what Medicaid expansion does. The other thing that it does, yes.
Well, I was going to ask, you said other states, kind of show us what we've seen in other states shows us that, people are going to have trouble complying with the paperwork. These are states that enacted work requirements without being told to do so by the federal government.
Yeah, absolutely.
Yeah.
So Georgia did that. Arkansas is the example you always see. They enacted work requirements as when they expanded Medicaid. Louisiana did not, and we saw and there's data to show it. I didn't put it in a slide, but it's easy to Google, and the vast majority are people who meet work who just didn't meet the paperwork requirements, but were still eligible. And there are a lot of people who maybe have good reasons for not being able to work. Maybe they're taking care of a relative. Maybe they are, maybe they have a mental health issue. People have all kinds of reasons for not going out into the workforce, um, and it's usually a good reason. And they are still deserving of health care. And I don't think you're not. And the other thing about work requirements is we know also from the experience of many other states that it doesn't actually increase employment. That somebody who is not working isn't going to suddenly start to work in order to get Medicaid.
Well,
Um,
and when you talked about people going to the emergency room or, whatever, people that don't now have a plan, they've got no structured way to get their health care. So something goes wrong, they show up to the ER. At the ER, they don't have coverage. So then the ER has a responsibility to see that person. Like the Hippocratic Oath, it's basically a
yeah.
responsibility to not turn people away and let bad things happen. And so we had all of these things that we did as a state before we expanded Medicaid to compensate the hospitals for that coverage. And we've been spending a lot less on that. Like I just remember the word dish, like a disproportionate share and different payments that went for uncompensated care. So, I mean, is this the kind of thing that you likely see having to get picked back up, or the hospital's going to be stuck with that care?
Well, we don't know. This law is only 6 months old, so we don't know yet for sure. But absolutely, that is the risk, and Congress kind of acknowledged that risk when they included a rural healthcare fund, because one of the things they understood was that if people in rural areas lose coverage, then it's going to put a huge financial squeeze on rural healthcare centers and they might close. Thanks to Medicaid expansion, Louisiana is one of the only southern states that hasn't had any rural hospital closures over the past decade. Congress understood that they were putting a lot of pressure on these rural healthcare providers, so they included a fund. Um, but the numbers that I've seen suggest that the fund and Louisiana, there was just an announcement a couple of weeks ago that of Louisiana's share of that fund. It's not enough to offset the loss of funding that's included in the bill, because the Medicaid piece, nationally, it's almost $1 trillion. That was the big pay for the tax cuts. The other big thing, and I think this is really from a state budget perspective that's critical, is that starting in 2027, it caps and then lowers the amount of money that the state can charge in provider taxes. And provider taxes is one of these very arcane subjects, but it is how we fund the state's share, or a lot of the state's share, of the Medicaid program. And when you talk about provider taxes, these are taxes that hospitals and nursing homes and healthcare providers are very happy to pay, because they put up the money and they get way more money back than they put up through the tax.
Yeah.
And so we are actually in the process of researching this, and it's not ready yet, but it will be soon. But our early estimates are that, especially on the hospital side, when that provider tax ratchets down, it would be about a $200 million a year hit to the state budget, that we would have to find some other way to come up with that state share, take it out of the general fund. Because right now, Medicaid is a really good deal from the state, because the federal match is so high, and because we have these financial mechanisms in place to come up with some, not all, of the state's share.
Right.
Um,
So I was, in the legislature when they came up with this whole provider tax idea and something called the Hospital Stabilization Fund. And it's the hospitals that wanted it and I don't know, came up with the idea in all likelihood. I'm not exactly sure. I'm sure they copied off of other states, but they pay in these taxes so that there's more money for use by the state government to pay for care that then draws down the 2/3 match from the federal government. So
Right.
it's really important.
Yeah, it's a very arcane subject, and I don't expect anybody to become an expert on provider taxes because I'm just getting my arms around it now, and I rely on staff to do all the numbers crunching. But just suffice it to say that between the extra cost of SNAP and the extra cost to the state for Medicaid, we have these two huge cost pressures coming down from the federal government on two of the biggest programs that the state operates. We also have cost pressures that the state has created. For example, incarceration. We took back a lot of the criminal justice reforms. We're going to put more people in jail going forward. That comes with a cost. And then we also have these education savings accounts that the governor and the legislature created that creates a whole new category of people who would get scholarship aid, which is families that are already sending their kids to private school would get a state voucher to help offset that cost. Again, the legislature so far has put a cap on that, but there's a lot of pressure to lift that cap and provide this aid to anybody who wants it. So you have these cost pressures from the feds. You have these cost pressures that the legislature created. Never mind the kind of standard cost pressures. Teachers haven't gotten a permanent raise in 4 years at this point. We don't put pay raises into the MFP anymore. Um, and you're doing this with a budget, a revenue picture that is basically flat and slightly declining. So my broadest message on the state budget, if you're in New Orleans or you're in Baton Rouge, you've already seen your local city government be in a financial crisis, a budget crisis. I really believe that is a preview of things to come at the state level. We're not there yet, but a year from now, 2 years from now, we are going to be back in that deficit posture that we haven't seen since for almost a decade at this point. So I hate to be that bearer of bad news. These are the snap changes. Um, so what can we do about it? And I know I'm kind of running out of time here, and I want to turn things over to my friend Peter. But you know, I'm a broken record on the minimum wage, but you've heard about the K-shaped economy. That's a lot of what we talk about. People at the top are doing very, very well. People in the middle are kind of holding on. People at the bottom are losing ground. That's been the story, not just in Louisiana, but around the country. This year, in 2026, for the first time ever, there are more workers living in states with a $15 an hour minimum wage than there are in states with a $7.25 minimum. And Louisiana is one of 5 states that don't have any minimum wage on the books, so we default to the federal minimum. Um, if the federal minimum wage, which last went up on, I think, July 24th, 2009, had just kept up with inflation, it would be almost $11 an hour today. I did a little back of the envelope math last night because I got curious. So don't take this money to the bank, this number to the bank. But I think it is a conservative estimate that about 200,000 Louisiana workers right now have wages below $11 an hour. So what we're saying here is that there are 200,000 people working in Louisiana right now who are paid less than the lowest paid workers were getting paid during the Kathleen Blanco administration. Think about how long ago, or no, well, no, I guess it was the second year of Jindal. Um, and May 25th makes 19 years since the last time Congress acted on this. I don't see Congress doing anything on this anytime in the near future. So we have an affordability crisis in Louisiana and everywhere else. And one way we can address that affordability crisis is to simply make sure people get paid more for the work they're actually doing. Yeah.
So You said that there are more people living in, oh, there's more people living in states with $15 minimum wage than in states with $7.25, which is partially because those states have higher populations.
Yeah,
But still, if we need workforce, and we're always talking about how badly we need workforce, I mean, it's at least got to be something that we should be thinking about. That maybe this is part of the issue with attracting workforce, with certainly the benefits cliff that we talk about, where it's not worth going back. I mean, you don't ever want to say it that way, but it's not worth going back to work because you'd lose so much benefits and you would not make enough to cover what you lose. And yeah,
yeah.
19 years. Mm.
It's been 19 years, and look, I'm not blind to the political realities, but I think, because I'm speaking to this wonderful group, I just think that we need more people making the case, because it really the evidence is very clear that it's not going to kill jobs. If it does kill any jobs, there are jobs that probably need to be killed. If people and people who lose their jobs, if the minimum wage were to go up to $12 or $15 an hour, would find another job. There's the job market is dynamic. We've learned from other states that it just is a policy that works. You just need to have the political will to implement it. So I think that I put that first.
And a lot of
Um,
these people that are making less than $11 an hour, a good chunk of them are watching our kids.
yeah.
These are the early childhood education people,
They're
just
watching our
general
kids.
laborers.
They're watching our elderly in nursing homes.
Yeah.
They are doing retail jobs. They are doing jobs that we're lucky to be able to spend a Thursday afternoon on a policy call. Um, the other thing, and this is kind of goes back to what I was talking about earlier, is just delay these cost shares. Congress passed this law passing on costs to the state. Congress can delay or eliminate those cost share requirements, and so that's not really a Louisiana question, but we do have the speaker and a majority leader, and a senior member of the Senate Finance Committee, all representing Louisiana. We have a lot of power in Washington, and so that's one thing we can do. If we're not willing to raise the wage, if we're not willing to tell private employers that they need to pay higher wages, we can. There are a couple of things that we can do to make life easier on families, particularly families with children. The earned income tax credit is a proven anti-poverty tool. Louisiana is lucky to be one of the southern states. We were the first southern states to enact a state level EITC. We are now the lowest of the 31 states that has a state level earned income tax credit. Of course, this is money that goes mostly to families with low incomes who have children. Um, there are one of the good things that came out of the one big beautiful bill was a nominal increase in the child tax credit. It wasn't good enough. There was still some, a lot of families excluded, but it did increase. Uh, but 15 states plus district have taken it on themselves to provide their own child tax credit, which again offsets the cost of raising children. Um, 13 states plus DC offer paid family leave for all workers. That is a critical tool to helping people survive, particularly with low incomes. Thanks to John Bell Edwards and the State Civil Service Commission and Jeff Landry for maintaining it, all state workers now have access to paid leave. That was expanded to higher ed employees last 2 years ago. The next step, I think, is making sure K through 12 teachers have the same access, and ultimately, we want to see that available to everybody who works a certain number of hours for a certain number of time. That is something that is doable, but it costs money.
So did you say K, like one of the things that you guys see as solutions is to add K through 12 to that? So they're state
Yeah,
workers, kind of, because they're also parish, but that's
yeah.
why
So
they're
right
not.
now, paid I'm married to a second grade teacher who went back to work after 8 weeks when our second child was born because there was no paid leave in East Baton Rouge. So this is an issue that hits home for me, but it is not very costly. There was a study commission that put out a report in December, and the fiscal note is really not that large because all you're really doing is covering the cost of substitutes when a teacher takes parental leave. So it's the fiscal note is not as high as you think, but right now it is not available to public K through 12 teachers and support personnel, and that is a policy solution that again is I think affordable in the current environment. Um,
Well, Jan, a lot of people kind of, and I was in the same place at a point that, like you think about a small office, like you've got 5 people, right? You've got 5 people, you have paid family leave that the company's mandated to pay for. And one of those people goes out and that work doesn't go away. So you're still paying them. And now you have to find a way to pay somebody else. And that always stressed, me out. But a lot of states are handling it almost like we handle unemployment taxes,
that's
that the
exactly
all companies pay in some nominal amount of tax, and it covers this issue for all companies.
that is exactly how you do it. We have a report. It's a couple of years old now, but I'd be happy to send it along. But yeah, it would be a small payroll tax that everybody would pay, and it's essentially insurance that covers, doesn't replace full wages, but makes it so that people who have give birth or have family caregiving responsibilities are able to take some time off, and that the cost doesn't fall on the employer. And so that is something that is very doable, but again, politically difficult. Um, this is my last slide. I just want to kind of say tax cuts don't pay for themselves, because when you cut taxes at the state level, because we have a balanced budget requirement, we don't print our own money, you reduce the amount of money that comes into state government that's available to pay for services. Right now, the system we have is regressive. It is inadequate to our current and future needs. Now we have a regular session coming up, so I'm not going to talk about tax policy because now is not the year, and probably realistically next year is not the year because it's an election year, and I think nobody wants to have a big tax reform conversation in 2027. I'd love that. Um, but I did hear the governor today say that his goal is still to eliminate the personal income tax, which, even though it's been cut, still brings in an enormous amount of money every year. And so if you do that, you have to make really deep cuts or you have to raise taxes elsewhere. So there's a huge cost to that. And it's something that policymakers should be aware of, and they should understand that what we pay for. Um, and just the last thought I'll leave with you is, we need more investments in the things that we know will ultimately grow our economy over the long term, and that means investing in people. That's why we changed our name to Invest in Louisiana, because we really believe that you build a strong economy, which we all want, conservatives, liberal. I really believe there's more common ground than we sometimes admit or sometimes we see on social media. But we all want a good education for our kids. We want to make sure healthcare is affordable and accessible. We want good roads. We want safe streets. And the ways to have those, unfortunately, it requires public investments, strong, sustainable public investments backed by a tax code that is strong and sustainable and not out of line with other states. There are ways that you can raise taxes that would probably be counterproductive.
And I recognize that we are a little bit over. So if you guys just have a little patience with us, but I think this information is important to understand. So, Peter?
Yeah. Well, so first of all, thank you very much for having me. Really appreciate the opportunity to talk to everybody today, including a lot of folks who I recognize, or at least your names I recognize. Um, I'll just very briefly, I'll try and be fairly quick, and I actually kind of prefer when I get to talk to groups to try to open things up for questions, to make sure that I'm addressing the things that you really want to hear about. So I'll try to move through this pretty quickly, but also want to just lift up that would love to answer questions if we end up having time for it. I dropped our, instead of giving kind of a big rundown of who we are and what we do, I'll just say that we are a public policy and advocacy organization. We advocate for poor and working class Louisianans, similar to what Invest in Louisiana does. So a lot of overlap. Jan and I are good friends and work together on a regular basis. This is not the first time we've been panelists together on something like this. So we got a pretty good rhythm down, I think. And then just in general, if what does that mean to be, working on public policy and fighting for poor and working class Louisianans, and how does that maybe even differ from what Invest does? If you do have the opportunity to go to our website, and I'll drop the link in here as well. We have a policy advocacy page where we give a rundown of a lot of the stuff we've worked on over the years. A lot of it is stuff that we would describe as decriminalizing poverty, so government fines and fees and debt collection practices, low level, trying to reform low level drug offenses and traffic enforcement, government transparency. I mean, the list kind of goes on and jumps over a lot of different issues. So I'm not going to go through it all, but if anybody's interested, you can check out those links that I dropped in the chat. I want to pick up, and I'll also note that we work very closely with the labor unions in the state, the Louisiana AFL-CIO, and a lot of our work is in the labor field, both in terms of sort of organizing and policy and politics. I want to pick up on one note that Jan kind of kicked his presentation off, and it's the Gini coefficient number that he mentioned, which is really a way of trying to sort of objectively measure income inequality, wealth inequality in a state. It's not a perfect measure, but it's kind of the best thing we have. And, Jan noted that we're fourth. We're fourth behind places with lots of billionaires in them. And so if you kind of remove the disproportionate number of billionaires in, say, California or New York, or you're trying to kind of correct for that, we're actually kind of number one when we look at wealth inequality. And I think what that reflects is that when we talk about, oh, Louisiana is always at the top of the bad lists or the bottom of the good lists, Louisiana is a wonderful place if you are in that sort of ownership class, or in toward the top of the kind of professional service classes, which a lot of our legislators and other leaders are. I would imagine a lot of the folks on this call would kind of fall into one of those categories. You have access to good education and a lot of the other things that we think of as quality of life issues. What us being, like I said, at the bottom of those good lists, top of those bad lists. And then I think this also reflects when we look at our overall in migration versus out migration and the declining population in Louisiana, is that uh, life in Louisiana is not very good, or in some cases just really bad, if you aren't in one of those sort of, upper socioeconomic classes. Um, and so, how did we get there and why are we there? It's a problem throughout the South, just more acute here in Louisiana. The South is built on, you got to look at history and how these things develop over time. And, we were built on a plantation class system, right? And we were built on low wage, if not no wage, labor over the course of the past 400 years, right? And so our system today, while it's certainly changed over that time, reflects that history. And so when we talk about why people, might be leaving our state or why people might not want to be coming to our state, I think it's really reflective of the overall situation. And let's just kind of call it, generally speaking, quality of life, if you're not, again, in one of those kind of upper level socioeconomic classes, right? And then when you talk about businesses either staying here or maybe relocating here, because of that, they don't have access to the kind of pool of, say, talent that they might find in other places because of a lack of investment. They don't have, because we haven't invested in, infrastructure and public education and some of the things Jan was talking about at the level of other places. Again, it's not necessarily a great place when you're looking to locate. And while tax structure certainly plays a role in how businesses move around, really the first thing they're looking for is am I going to be able to find and hire good workers? And if I have to relocate people, are they going to want to, live in these places that I'm looking to build out in? And that's just, again, not the case for most people. Um, and, a lot of that Jan also touched on was sort of policies around what it means and what you can do as a worker in this state. We've seen, just a really recalcitrant approach to even, talking about raising the minimum wage, to talking about paid leave policies, things that even in other conservative states are at least on the table. Or, we talk about, Jan talked about K through 12 teachers with paid leave. South Carolina, which is certainly a very conservative southern state, has expanded that. It's The ball has barely gotten rolling here in Louisiana, and it's something that we see time and time again. The minimum wage, you can't even get it out of a committee in the Louisiana legislature, let alone have a broader discussion about it. And, so because of the difficulty in moving a lot of those policies, what we have tried to find at Progress is what are some other ways that we can actually really improve the life and the quality of life for, again, poor and working class Louisianans. That's why we've continued to look at decriminalizing poverty and those fines and fees and some of these other issues. Because, given that it's difficult to move some of those sort of direct worker related policies, how can we just make life better, right? And when you find that in a lot of cases, state and local government is, I wouldn't even say nickel and diming, right? Like $5 and $10 or $50 and $100 people everywhere they can to make up for some of those budget shortfalls that Jan discussed. And then that also feels like you're being sort of victimized by your government, right? When we talk about trust in government and potential buy-in to the political system, when you feel like your own government's kind of attacking you a lot of the time and trying to, pick your pocket, that doesn't help. Julie, it looked like you had a question.
I did. Thank you for that. I wanted to understand what you meant by decriminalizing poverty.
Yeah, so one of the ways we have kind of kept this very strong class system in place is, again, we sort of I would argue over criminalize lower level offenses, uh, and or if you don't have the means to say hire a good attorney or pay an initial fine, we tack more fines and more fees on top of that. We don't have any sort of a statute of limitations. So I've actually known several people who've gone to prison for long periods of time. They get out, and you talk about trying to stop the revolving door of the criminal justice system. Well, they get out and they come out to meet hundreds, if not thousands of dollars in like fines that are 20 years old. When you come out into that situation and you're, put into even deeper poverty than maybe you were when you began, that's going to make it very difficult for you to kind of get up on your feet and start a new life. Um, and really, like, I would even point to not just criminal, but our Office of Motor Vehicles has gone from what its mission is supposed to be of, just sort of handling licenses and registrations and making sure folks are, to actually really a debt generation and collection agency. The OMV currently claims that they have $450 million in sort of outstanding debt that they count as revenue, actually, most of which they will never collect. And then what do they do in an attempt to collect that? They suspend people's driver's licenses. It's very hard to find a job, get to work, do all the things you need to do when your license has been suspended. And then they make it expensive to get your license back. So that's
Like
one way.
what? I'm sorry. I'm just curious because I'm like, wow, wait, what does this debt generate? Like, what kind of fees are these that we're talking about?
The biggest generator is around insurance lapses. So we have had some progress on this. For a long time, though, it was essentially if your auto insurance lapsed for literally 1 minute, you were assessed a fine. And then if you didn't get everything corrected, essentially within a few days, you could have your license suspended, and then you were looking at a reinstatement fee. And again, if you couldn't afford to pay those multiple hundreds of dollars, if you're choosing between that and keeping the lights on or paying for groceries, these things would just start to rack up and rack up, and you could be looking at hundreds, if not thousands of dollars, ultimately down the line, basically because your insurance lapsed for a minute. And I know a lot of people, again, regardless of socioeconomic status, who missed, oh, I didn't get the letter, my bank draft didn't work, something of that nature. And I see
Huh.
Jan has his hand up.
Yeah, Julie, you might remember this. This was one of those things. It happened at the last minute of a legislative session. It was one of those like snake in the grass bills when there was a budget crisis, and they put in they like doubled and tripled these fees so that they could use the money for a pay raise for the state police. And
Ah,
it was one of those amendments that was just kind of snuck in on the last day, and it was discovered after sine die.
wow.
Um, and
Yeah.
it's been and now we have some of the highest fees in the country. I remember the day because I think I remember complaining about it at the time. I've been doing this
Yeah.
too
Well,
long.
if your insurance lapses, the only, I'm probably wrong. I'm just, but the only way they would find that out is if you get pulled over, right? Or is there a reporting mechanism?
There's a reporting back and forth process between insurance companies and
And,
the OMV, and so it's actually flagged almost immediately, and that's where again, going back to the time that Jan mentioned, this was not really what the OMV used to do. I mean, there's other ways that 450 million is generated, but a huge bulk of it is actually around these insurance lapses. Over time, we have now created some grace periods. It's up to 10 days now, so you have 10 days the first time it happens to you to correct it. But again, we still have literally hundreds of thousands of people who are sort of trapped under that old system who accrued these fines and fees and driver's license suspensions. So that is one thing, and we're continuing to work on that. We actually have, I do want to just turn really briefly because I know we're getting close to
yeah.
time. Um, and so talking about what can we do, right? And what does it mean if we can't raise the minimum wage, or that's going to be, paid leave, those types of things. Well, obviously, and I think we all feel this again, regardless of socioeconomic status, the cost of living and affordability issues that are being talked about all around the country, all around the world, really. A lot of reasons for that happening, and I'm not going to. And that again could be a whole other sort of policy discussion, one that I would be happy to have. So if you decide to talk about that, please invite me back. But what we started asking on our team about a year and a half ago really was, what does it mean to sort of attack the cost of living or affordability crisis via, in particular, state policy, right? And so we have spent a year and a half researching best practices around the country, other states, new ideas that are coming out, and we've actually put together a 26-point policy agenda that we are going to be bringing into the legislature this year. We already have sponsors for most everything on there and are kind of working that. We have model legislation. I don't want to go. I'm not going to go through all 26 points for sure. I did just want to lift up the buckets that we're looking at. So we're looking at consumer protections, and one just basic example around that is what they call click to cancel. It should be as easy to cancel a subscription as it is to sign up for one. We have several other consumer protections. Government fines and fees and debt collection. A lot of it around what OMV does, but even some stuff in the criminal justice system, as I've kind of referred to earlier. We're really diving into healthcare access and cost. Uh, things around hospital pricing transparency, medical debt collection, a few other kind of big issues. And again, with the changes in health insurance premiums, we're seeing that become just an even bigger issue. And then we are a little bit around housing, and then quite a bit around labor, although labor in a way that with a few of these things that we think can actually gain some momentum in the legislature. And one of them I'll just lift up in particular because we're looking at a lot of AI regulation is what's called the No Robo Bosses Act. So a lot of employers in just obviously the last couple of years have started turning over a lot of their HR practices to algorithms and AI, and without any meaningful human oversight. And what we're finding is that these AI programs are actually end up engaging in a lot of the same kinds of discrimination that are outlawed if a human was doing it. And then when the companies are when that's brought up, they're like, oh well, it wasn't us, it was just the program. And so what we want to do is ensure a meaningful level of human oversight and ensure that employees get to have appeal rights, which has been a major issue around this. Lots of lawsuits going on around this around the country. But yeah, so we're really trying to just kind of throw a lot of different stuff at the wall. These are things that are not, at least, nationally sort of left versus right. These are things that have had both in the federal government and in state governments buy-in across the political spectrum, across sort of geographies. It's something that impacts urban, suburban, and rural folks. And we have a bipartisan buy-in. We've got several Republican sponsors, several Democratic sponsors. And so we're really excited about hopefully being able to come and say, if you want to address quality of life and affordability issues for people, we're giving you a big menu of options. Let's get some of this done to make our state a place where people want to stay, people want to come, and then ultimately, obviously, grow the economy.
Peter and Jan, we just so appreciate, you sharing your time with us today. And we appreciate trying to lift it up on an optimistic note at the end. I love the things you said. I really greatly appreciate everything about what we just talked about and experienced. We're in the end, we're a data-driven bipartisan organization. So understanding all of the issues is so critical to our mission. And you did a really good job of articulating those issues today. Thank you to all of you who are out there listening. And we hope that, just like what we just talked about, to let it in and think about it. In the meantime, we'll see you next time. Thank you. If you're interested in these types of policy talks, check us out on Ellevate Louisiana's website, where you can learn more about our events, our policy committees, advocacy efforts, and how to join. That website is ellevatela.org, ELLEVATELA.org. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who needs to hear it.